Hello, everyone, and thank you for joining us for Hear Me Now, Innovative Storytelling in Uncertain Times, the Patient Advocate Foundation Spring 25 Innovation Summit. I'm Gwen Darien, and I lead patient advocacy, engagement, and education, and our team is a team that develops and produces all of these summits that we do in November and in May. And I think some of you have been here have come to a number of our summits, and you'll see that there are always themes and there are always things that we speak about with an underpinning of equitable access. Our underlying value is equitable access to quality, affordable healthcare for everyone. And in this, and much of our work revolves around storytelling and radical listening. And in this summit, we're going to really look at innovative storytelling, narrative power, and solidarity. When I think about stories, I was just sort of thinking about a list of things it's a list of some of the reasons that stories are so powerful, and also thinking about it from a perspective of both giving and receiving stories. And when I think about stories, I think about the aspect of connectedness and how stories connect us to each other and how stories allow us to hear other people's experience through their lens. I think of that as making sense. How do we make sense of what's happening in the world? And in these uncertain times, it's particularly important that we make sense of what's happening in the world, but that we also do it in a way and to have the power to impact change, or the change, the system, and the change we want to see, and what these things mean to us. Stories can be very thought provoking. It is wonderful to learn new things. It's wonderful to have look at different ways of thinking. They can be transporting. And in many ways at this time, it's as important for us to keep our energy up, to be transported, to go into a different world as it is to act. And I think we don't want to forget that is one of the powers of stories. They are energizing. Hearing stories and telling stories can be energizing both through what we're able to do by making sense of our experience, our lives, our families, our communities, but also what we hear from others. And of course, they're a catalyst to change. They can be a catalyst to change, and that will be one of the major themes that we're going to talk about today. They're inspiring. We learn from others, particularly if we listen with an open heart to what people are saying, rather than seeing it through the lens of our assumptions and our experiences. We hear about new perspectives. We hear about experiences that we may never have had, but that it's really important for us to understand our experience by many, many others, especially as we're working towards solidarity. And they also help us kind of understand the consequences. And as we think about the times we're in, the uncertain times we're in, this morning with the budget bill that could significantly cut funding for healthcare, it's really important to tell the stories and listen to the stories that really show what the consequences may be on multiple levels: individual, family, community, country. So in these uncertain times, I feel much more called to listen than to tell, and to connect and be in community. And I'm hoping that we will, those are some of the things that you will take away from this moment and take away from this afternoon. We have an incredibly rich agenda and a very powerful lineup of speakers. So I'm just going to go through our agenda. And as you'll see, we're doing a few things that are slightly different than we've done in the past. And so we have a series of stories that are woven through from very different perspectives that are woven throughout our summit today. So we're going to start with a keynote. We're going to start with a story from our friend and truth teller, Beverly Rogers. And our keynote is by Dr. Aletha Maybank. Many of you may know Dr. Maybank's work about building narrative power. We have another story from a medical school resident, Dr. Lash Nolan. We're going to have a panel on how we achieve radical empathy through narratives and the power of storytelling. And as I mentioned before, the idea of listening and the commitment, not the idea, but the commitment to listen with an open heart and not assume that you know how other people are feeling. You want to learn from them rather than hear their stories from your own assumptions. We'll have a story by Jay Brown about research and whose story research is telling. And then we have a talk which will be very interactive by Dr. Rachel Grob, Getting Out of the Box, How Narratives Can Transform Research. And there's been a lot of research and work around narratives, around stories, and Rachel will tell us about some of the work that they're doing at the University of Wisconsin. And then we have a very powerful story from one of our colleagues at Deaf Health, a deaf woman, Alyssa Dittmar, and then we were going to talk a little bit about how we can make stories work in media and politics. So we want to inspire people. We want with things to be evocative. We also want to be pragmatic in terms of what we can do with stories and how stories and narratives can work in the media and politics. And we will have a story from a group at the University of Illinois, Chicago, Conocimiento es Poder, which is knowledge is power. And we finish up with closing remarks. I'll do a few closing remarks, and then a very inspiring call to action by Dr. Robert Wynn. Thank you.